Good afternoon, everyone. We are unfortunately on the last day of the Summit 2021. I'm surrounded by the best expert in the field, and we'll wrap up today for you, and we will tell you what we have seen today. I will begin with Mo and ideas.
Thanks, Afshin. It was another long and exciting day. It was very full of interesting sessions. The day started early with the controversy sessions on infrarenal EVARs. A lot of ideas about how to deliver the service and how that affects the patient's care and training. And also there was some very mature and balanced discussion about dealing with difficult necks. I really enjoyed that. And then there was a session of chronic aortic dissection and different approaches, bringing cardiac surgeons, vascular surgeons, interventional radiologists into the table, discussing various options. In the afternoon, there was a very good session that I really enjoyed it, video recorded cases, 4 cases, interventional radiologists and vascular surgeons presenting some new technology and some new techniques, a lot of things that I really enjoyed and learned from that session. And the day culminated by the last but not least session of the EVAR workshop by 2 eminent interventional radiologists and vascular surgeons. Very well planned and very well delivered, and I really enjoyed it. And I really encourage everybody who missed any of those sessions to go to the on-demand and watch those sessions.
You know what I like in this ideas is the multidisciplinary, which is absolutely natural by you.
Absolutely. It does show you how when people put ego aside and sit on a table and put their ideas and discuss their experience, you can feel it. How, if I was a patient, I really feel confident and safe in the hands of those people.
That's the message. I think that's the real message. I think we will repeat this next year in face-to-face.
Absolutely.
In Barcelona.
Absolutely.
Thank you so much more for all the amount of the work you put and the energy you put in this ideas program. Thank you so much. Thank you so much. Now I'm turning to Jerry. Your favorite for today. I know we are using you every day, asking you so much.
It's been fun. I have to say, it has been an amazing Congress for me. I've learned a ton of stuff, and as Mo has mentioned, the on-demand thing is fantastic because there just aren't enough hours in the day to look at all the sessions you want to look at. But today there were 3 things that caught my eye, and there was a workshop on prostate arterial embolization, which was really good. It was really practical, in-depth patient selection, planning, how to do it procedurally, things to avoid, lessons learned. Just a perfect workshop. I thought it was excellent, and I would say it's recommended viewing, really, if you're going to embark on a prostate arterial embolization in your department. There was an expert roundtable on acute pulmonary embolus, which brought in various strands, so medical, pharmacological, endovascular, surgical, how to manage these patients, how to categorize them into submassive, massive, and so on. And I think that's really worthwhile, and I think it'll help a lot of departments and interventionalists set up or firm up their pulmonary embolus response team. We have one in Galway now. It's all on, we use WhatsApp as it happens, and you get a picture of the ECG, you get a picture of the echo or a video of the echo, and it's practical, it's quick. We see the numbers and we pretty much instantly decide between us, this is what we're going to do, boom, and the patient moves either to the IR suite or to ICU or step down entirely and just goes to anticoagulation or whatever. And then finally, I thought it was a very mature session by the IR trainees on stress and how to handle it. And I think that's something, well, the whole COVID situation is brought to a fore. I found, I think we all found aspects challenging. I must say I found January, February this year when the numbers were peaking and every second patient in the hospital seemed to be COVID positive, and it made our work as interventionalists so much more difficult, wearing first of all your scrubs and then your lead and then the full outfit, and it just everything became really, really hard, and I found it stressful, and I know a lot of my colleagues did too. So I think it was a very good session in the IR trainee session, talking about specific things. I want to do IR as an academic career, or I'm IR on call solely in a peripheral hospital, or I'm an IR with kids or whatever. it was just practical. It was really good. And I think it's something, again, that you can pick up on demand and pick up just a few little tidbits about how to deal with stressful situations. I think most of us have felt this last year and a half has been stressful, so it's a good way out of it. But I suppose my final thoughts are I'm looking so much forward to meeting in person next year in Barcelona. And because, you know, it's a city we all know and love. We've been fortunate enough. In fact, the last Congress was on in Barcelona, which is unbelievable that it's good. But in next year, it's going to be big. There's going to be intense face-to-face, and we are going to have a ball.
Absolutely, seeing each other face-to-face. I think what you point out about prostate is still a lot of controversy because, you know, that's a turf battles inside.
It is, yeah.
That's something really hard, but the patients are getting aware of the technique and they're coming directly to us. That's important.
Yeah, I think one of the things I've learned, I get on very well with my urologist, and I have deliberately not tried to sort of grab this, you know. But what I have learned is that they refer a lot of patients to me who have had a TURP and have failed, or have had a TURP and are now on anticoagulation and have intractable hematuria. And so we're picking up a lot of the cases that they can't do much with. And as a result then, I'm doing MRIs as I do on my fibroids at pre and at 3 months post. And what they're impressed with is, first of all, the patient's symptoms are way better. And secondly, their volume on MRI is down to like 50% at 3 months. So they actually can see the benefit. And I'm not saying we've got all the answers by any manner of means, but I think that it was something that I was quite afraid of, say, 2 years ago. Not afraid of, but I was afraid to take it on because the cases were taking a long time, 2.5, 3 hours. And now I've got it down to pretty much an hour, you know. Fibroids are obviously quicker, but what I've learned is that you don't have to get an absolutely perfect result to get a significant diminution in volume. And I think that's something that only comes with experience. And I'm by no means, I couldn't dream of doing the workshop, but I can certainly learn from the workshop. So thank you
so much, Jerry. Thank you for all the energy you put in this meeting for us.
You know I love this meeting. I just love it. So
thank you, Jerry. We are delighted to have Alex with us. Alex, your favorite today.
Yeah, there were a couple of slightly different topics today that I really enjoyed. First off, this morning there was the COVID, IR and COVID session, which of course is very pertinent to where we are this year and was an excellent summary of what we've learned in the last 18 months, I think, as an organization and as a specialty as well. So we were looking at some of the clinical presentations of the patients that we've seen over the years and what we've learnt from that, but also how we have responded to support hospital services over that time. And I think actually it has been a great opportunity for IR in some respects in terms of showing how flexible and innovative we can be.
Absolutely.
We've been able to pick up work that our surgical colleagues have just been unable to deliver. So that's been pretty exciting. There's the downside of the patients presenting late, particularly for interventional oncology, and I enjoyed that talk and looking at the COVID perspectives on that patient cohort. And then finally, there was an interesting talk about pandemics of the future and what we've learnt, how we've learnt to become resilient and innovative and how that can feed into how we can respond for future healthcare crises. I thought that was fascinating. And that leads a little bit into the later session during the day, the expert roundtable looking at the delivery of IR, how we need to look at ourselves as an organization, how we can build our reputation and increase our scope of practice.
Absolutely.
And this has always been pertinent to IR, but ever more so now, I think. And I really enjoyed that session. The final talk was about economic modeling in different geographical regions, and I'm very interested in that. I have done a little bit of work in developing economies, such as Sri Lanka, and I find it fascinating seeing how IR can be delivered in very constrained economic models like that. I certainly learned a lot from going there, and I think we should be thinking harder about how IR looks for people in other economies around the world, not just for us here in Europe. So I particularly enjoyed those sessions. They were great.
I think I agree with you that, going through the COVID time, even if it's a nightmare, we have done a lot of progress. It brought us, some experience, and we can be better next time.
Yeah, for sure. Yeah.
I think that's important. You know, this morning I was, as you said, with our colleague of Russia in a meeting, exactly what you said. In different geographical and different countries, the problems are similar but completely different sometimes than ours. We can bring them something, and I learned a lot from them, how they deal with the situation, difficult situation they have.
Yeah, for sure. I agree.
Thank you so much,
No
Alex.
worries.
Thank you so much. And we are lucky to have the Vice President of CIRSE, Christoph. Your point, I think you love radial approach, I know, and it falls exactly where you want it to.
Absolutely. Let's start at the end of the day then, the radial session. I think, as you said, Afshin, I think this is something needs to be picked up by more interventional radiologists. I think the controversy session is a great format, but I'm really looking forward to the face-to-face controversials because the online you can see the different debate, but it never has this intensity or fire when you have an audience in front of you, and then you exactly can discuss. So I'm really very much looking forward to have this in a face-to-face. Nevertheless, I think the session really showed you a little bit the more conservative, and they have their points, and then a little bit more, I would say, proactive IRs. At the end of the day, I think you really have to think about the option. And I think the controversy showed it very clearly. You have to learn about it, but when you do it right, I think this is a great tool for us, and it really helps our patients because it's more comfortable. That's no questions about that. So I think this is really important. However, the controversy showed well that obviously there are some obstacles still. But one of the obstacles that needs to be surpassed should be the mindset. You actually at least be open to that solution.
Yeah, to change the mentalities. That's the hardest part, huh?
Yeah, exactly.
How was your impression about all the summit 2021, Chris?
I think, it was an online meeting. Nevertheless, I think we were able to, get some interactions going. I really liked that in actually most sessions, there was not just recorded talks, but there was always a discussion, the Slido tool, but also the interaction among the experts on each of the sessions. And I really was amazed, and I thank all the faculty members. To my knowledge, there was no show, so people were actually there, interacted. And even being online, I think whoever participated could feel a little bit that it was at least some interaction going. Nevertheless, Afshin, I think we exercised this now twice, so I really hope that next year in Barcelona we will be face-to-face and have the whole spirit back, which I'm really looking forward.
I think you're right. You have to thank our faculty. Some of them, in New Zealand, Australia, United States, have been with such a time zone. They have been there. They have been there. They have been there. Yes. I have to thank them really, particularly, and all the faculty, all the energy they have put in. As you said, no show. That's impressive. And what you said about the Slido and the question is many people who are very shy to ask questions this time, anonymous or not, they were asking questions they really want to. That's one positive point. You don't think so?
I absolutely agree, but I think we will have this also in the face-to-face. We will have this online tool.
Yes,
we have it already there. Although I think it's sometimes good to see the person asking questions. I think we should be able to, we should be so open that you can actually ask and not be anonymous. And I think also the queue in front of a microphone is also cool to see and then feel the intensity and the energy. Exactly right.
It's like the soccer game without any spectator. That's it. There is no atmosphere. Yeah, exactly, you're absolutely right. You're right. Thank you so much, Chris.
My pleasure.
I have the honor to wrap up the whole meeting now. I can tell you, being part of the CIRSE, as Jerry, Alex, Mo said, it's a great pleasure. But we don't have time to see all sessions. That's something we are missing. And I tell you, this weekend, I will be on demand, I think, all day. Everybody will complain, but I want to see this. And, you have the occasion. What you missed is not missed, is online and on demand. The good news is we are facing now 2 other meetings. We have ECIO and ET, and you know what? Face-to-face. Vienna and Nice, both are open. And we are looking forward to seeing you there. Use the on-demand, go to see the posters, go to see the industrial part. You know what? Everything is available. And what we are looking for now is next year, face-to-face in Barcelona. See you there.
Don't feel stupid at all.